Good morning to everyone, and thank you for giving me this opportunity. I'll be making this presentation on the challenges of reducing under 5 mortality at district level. And we will be discussing about the result of 2022 survey that was conducted in Mali, in Koutiala. Koutiala is found in the Sekasso region of Mali. In 2006, Sekasso region of Mali had the prevalence of acute malnutrition of 16%, and the under 5 mortality rate was 1.44 deaths per 10,000 per day. This situation in the region was slightly above the national average, as the prevalence nationwide, the prevalence of acute malnutrition nationwide was 15%, and under 5 mortality was 1.26 deaths per 10,000 per day. In July 2009, MSF started an intervention in Koutiala with the objective of reducing under 5 mortality in the district. The project in Koutiala is still running up to today, and the project offers medical and nutrition health care to children under the age of 5 years. Before 2022, 7 surveys were conducted in Koutiala to monitor key health indicators. The graph that you see on the screen shows the trend of under 5 mortality rate in the district according to the result of this survey. It indicates clearly that under 5 mortality rate reduced steadily from 2010 to 2014. On the other hand, the situation of malnutrition was more or less the same throughout the period of time, according to the graph that you see on the screen. After more than 12 years of MSF intervention in Koutiala, the project has undergone some modification in terms of geographic coverage and also in terms of healthcare package being offered. It was therefore important for MSF to have a picture of the health situation of the population currently. And this is why the survey in 2022 was conducted. The objective of this presentation is to present and discuss the result of the 2022 survey that was conducted in Koutiala, focusing on the mortality components and some explanatory factors. When it comes to the method of the survey, it was a cross-sectional survey with 2-stage cluster sampling targeting children 0 to 59 months. Households were selected with spatial random sampling. We should mention that the study area here was the same as study area that was done in previous, that was covered in previous surveys, except that this time around 2 health areas were excluded because of insecurity. The mortality component of this survey covered a period of 380 days from July 14, 2021 to July 28, 2022. Prevalence of acute malnutrition was estimated in children 6 to 59 months according to OEDEMA, weight to height ratio, and MWAC. As our result, 2,320 households were enrolled in the study, and we recorded 2% refusal. In total, 2,982 children 0 to 59 months were included in the study, and the sex ratio was approximately 1. When it comes to under 5 mortality, the average in the district according to this result was 0.54 deaths per 10,000 per day. We noticed that the under 5 mortality rate was slightly higher in the peripheral health areas than in the urban health area in Koutiala. The figure shows, the map shows the distribution of under 5 mortality rate in Koutiala Health District. And as you can see, the red arrow is pointing at Koutiala urban area. And as we move away from the Koutiala urban area, we notice that the mortality rate was increasing. On the other hand, we noted that 50% of deaths were recorded in children less than the age of 6 months. In this study, the main causes of death reported were malaria, respiratory infection, and diarrhea. It is worth noting that more than 1/4 of the cases, the cause of death were not known. When it comes to the places of death, approximately 65% of death happen at home and also at the healthcare center. 2 weeks before data collection, 27.6% of the children reported to have registered at least one episode of ill health. The causes of this ill health were malaria, diarrhea, respiratory tract infection in this order. We noted that the proportion of morbidity was a bit higher in the urban city than in the rural areas. Looking at the utilization of healthcare facility by these children that were ill, we noted that according to the map that you see, that in the periphery, more children who were ill visited the healthcare facility for healthcare seeking than in the urban area. On the contrary, in the urban area, more children visited secondary healthcare facility than in the rural area. Actually, in the rural area, we register only between 0 to 3% of children who visited the healthcare areas, the secondary healthcare facilities. When it comes to the situation of acute malnutrition, the prevalence of acute malnutrition in the district was approximately 11.6%, and this was more or less equally distributed throughout the district. Based on this result, we can see that the under 5 mortality rate in Koutiala has increased to what was observed in 2010. The main causes of death that we have registered are malaria, respiratory infection. It is difficult to know with certainty the main reasons why there's increase in under 5 mortality rate in Koutiala, but we think that low access to low utilization of secondary healthcare facility in the periphery can be a partial explanation. We also recognize that increased insecurity and the effect of COVID-19 pandemic could be some aggravating factors. However, these factors were not assessed in this study. Looking at the situation in the peripheral health areas, we notice moderate utilization of healthcare facility, very low utilization of secondary healthcare facility, and high mortality rate. This put into question the referral system in place and also access to healthcare. When we look at the situation of the prevalence of acute malnutrition, it is similar to what was observed in previous studies. This tells us that the high mortality rate registered this time around is not caused by malnutrition. We can conclude clearly that there's a problem of access to secondary health care in Koutiala, and this needs further investigation. Just to make mention that we are already working with MSF to assess the referral system in place in Koutiala, and also to assess barrier to healthcare access in the district. Before we end this presentation, we would like to thank everybody that was involved in the implementation of the surveys, both staff from MSF, Epicenter, and the Ministry of Health in Mali. I would like to especially thank Joseph Sagara and Thomas, who led these surveys. Thank you all for your keen attention.